And now for the Stephen Schroeder Award presentation. To present the award, I'd like to introduce my friend Chris Moriarty's from Cost of Care. Dr. Moriarty's is the executive director of that organization. They have had an enormous influence on the movement in this country to reduce costs of healthcare and to improve affordability. Dr. Moriarty's is co-author of a book that's on my shelf that I absolutely refer to probably at least once a month, Understanding Value-Based Healthcare, truly a recommended book. He has created the Discovering Value-Based Healthcare interactive learning modules that are used in training programs across the United States. And he's also the Assistant Dean for Healthcare Value at the Department of Medical Education, Associate Chair for Quality, Safety, and Value, and an Associate Professor at the Department of Internal Medicine at Dell Medical School at the University of Texas at Austin. So he's busy, and that's a good thing because you're doing good work. And one of the finest things you're doing is this particular award. We are so proud at Leapfrog to be partnering with Cost of Care on this prestigious award. Chris?
Thank you, Leah. That incredibly generous introduction. Our nonprofit, Cost of Care, is focused on building a pipeline of change agents who are working towards improving patient affordability and equity in healthcare. And one of the ways of doing that, we believe, is by highlighting and celebrating positive examples that inspire others. And so that's what's prompted us to team up with Leapfrog to create this Stephen Schroeder Award for Outstanding Healthcare CEO to highlight examples of courageous and ethical leadership addressing the twin issues of affordability and quality in healthcare. So first, let me introduce the man who the award is named after, one of my heroes in healthcare, Dr. Stephen Schroeder, who's a distinguished professor in health and healthcare at UC San Francisco. He had trained in internal medicine at Harvard and in epidemiology at the CDC, had multiple faculty positions before in 1980 founding the UCSF Division of General Internal Medicine, where there in the 80s, he was continuing his research on cost effectiveness in care and generalism in medicine. Between 1990 and 2002, he was president of the Robert Wood Johnson Foundation, where he initiated many impactful programs in tobacco control, as well as supported programs on the care at the end of life, worked to expand health insurance coverage, promote the advancement of minority health professionals, among many other things. Dr. Schroeder, we could go over your bio all day, but I will not do that. I will pass it over to you as our wonderful example of leading this work.
Chris, thanks so much. It's wonderful to be with you all. This pandemic we've been going through has reinforced the centrality of medical care to human health. But COVID-19 has also reemphasized how complicated is our healthcare system and how costly it can be. If we are to be proper guardians of our resources, we must be prudent, judicious, safe, and fair in how we deliver medical care. This award salutes visionary medical leaders who do just that. So thanks to the Cost of Care and Leapfrog for sponsoring this award, and heartfelt congratulations to Dr. Conroy and Dartmouth Hitchcock Health for designing and executing such an impressive set of programs. They are truly inspirational. Now back to you, Chris, and let's hear about why Dr. Conroy was honored with this award.
Wonderful. Thank you, Dr. Schroeder. So it's my honor on behalf of Cost of Care and Leapfrog to present the 2021 Stephen Schroeder Award for Outstanding Healthcare CEO to Dr. Joanne Conroy, who is President and CEO of Dartmouth Hitchcock and Dartmouth Hitchcock Health. Dr. Conroy is a committed leader in advancing equity in the workplace. She's a co-founder of Women of Impact, a nonpartisan group of 60 female healthcare leaders representing all sectors of healthcare industry across the nation. She's been named one of the 100 most influential people in healthcare by Modern Healthcare. And prior to joining Dartmouth Hitchcock, Dr. Conroy was CEO of Leahy Hospital and Medical Center in Burlington, Massachusetts, and was Chief Healthcare Officer for the Association of American Medical Colleges in Washington, D.C., amongst many other important positions. So we selected Dr. Conroy based on a number of impressive criteria. So first, it comes down to safety. Dartmouth Hitchcock has a record of patient safety. They achieved an A grade from Leapfrog in this past quarter, which is first and foremost. But they do that while promoting and avoiding low value care. So a 2021 JAMA Internal Medicine study came out this year looking at low value care practices at the health system level. And Dartmouth-Hitchcock Health was one of the top 15 health systems on their composite score across 28 measures of avoiding low value care. And Dartmouth-Hitchcock Hospital has helped lead the way around focusing on financial assistance and transparency for patients. So one of the first health systems that I know that had a patient-facing transparency tool and has made that important. So for these reasons, we selected Dr. Conroy for this award this year. And Dr. Conroy, it's my honor to present this award to you.
Chris and Leah and Stephen, thank you so much for recognizing not only me, but really recognizing our health system. You know, Dartmouth-Hitchcock is one of the most rural academic medical centers in the country. So when you combine a rural geography with all the pressures on the healthcare dollar right now, you have to be committed to value, to quality, to transparency, and actually to improving access. We are incredibly fortunate that our partner, the Geisel School of Medicine, has the Dartmouth Institute as a component of the medical school. Through our partnership, over 185 of our clinicians have actually achieved a MHCDS, which is a Master's of Healthcare Delivery Science, and or a Master's of Public Health degree. So imagine taking these close to 200 individuals and actually deploying them to think about how to improve healthcare. With TDI, we set up an incubator project where every year we have pitch night, which is about 60 projects come forward to improve quality, decrease costs, and improve safety for patients. And every single one of those has delivered positively on improving safety, improving patient experience, and decreasing our overall cost. I have to say that training people and giving them an environment to exercise their expertise is necessary, but it's not sufficient for success. And we have been focusing on eliminating that layer of no throughout every single organization. And all of you know what that is. That is that invisible layer in middle management that doesn't like to change how we do things. But frankly, the pandemic has taught us that the future is about being adaptable and changing how we deliver care in order to deliver the care in the right time, in the right place. So it's really my pleasure to celebrate not only my recognition, but accept the recognition on behalf of the entire health system. So thank you so much for this award.
Thank you, Dr. Conroy. It is a great pleasure to be able to award you this honor and to really salute your leadership as well as that of Dartmouth as really a pioneer in many respects in quality, safety, and an innovative approach to affordability in healthcare. And we need all of those things to be happening at a very rapid pace. And we're grateful that you're able to push us forward. I also want to say one other thing about Joanne Conroy, which is that, and Chris mentioned that she founded, and she grew an organization called Women of Impact, which I am also a member of. I've been very pleased to be part of. In what I think most people should know about Joanne Conroy is that she's a mentor to so many people across the country, count myself among them. And I think that is also going to have an impact, I think, for all of us as we look at the imperative of improving quality and affordability in healthcare, that we have leaders like Joanne who not only play such an instrumental role in their own health system, but also spread the wisdom across the country to people in all varieties of settings, whether it's me at Leapfrog or others at other health systems or in academia across the country. Every corner of this country, I think, has benefited in one way or another from your wisdom. So I am very, very pleased to have seen the committee select you for this award this year and congratulate you.
Thank you.
And thank you to everyone.